My name's Dr. Manrina Rhode, and on International Women's Day, I gave a webinar about 3 different factors. I talked about personal brand, communication with patients, and imposter syndrome. I'm going to give you a quick synopsis of the topics that I covered. Obviously on the day we went into a lot more depth, but let me give you a little bit of pointers today with this video. First of all, let's talk about personal brand and why it's important. I think whether you're a principal or an associate, it's really important to have your own personal brand within dentistry. I think we should all have, even associates should have their own personal brand websites where patients can find them and learn about them and see which treatments that they like to do, so they can have a better understanding about who they're coming to see. By building out a strong personal brand, then your patients can find the dentist that they want to see. And that is how you build your own tribe. You get to see the type of patients that you want to see because they want the treatments that you like to offer. You get to see the type of patients that like you because they've found you, they've learnt about you, and you're someone that they resonate with for treatments. And so you'll find that your work life's much more enjoyable because you're doing the type of treatments that you want to do on the type of patients that you want to see. So how do you go about building out that personal brand? Firstly, as I said initially, I'd encourage you to build out a website. And then through that website, you want a strong sense of self to come through. So you need to think about what your brand is and who you are. What's your brand color and font? What are the words that represent your brand? You want to spend some time working with a branding expert to create a brand guideline so that all through your brand, on your website presence, through your social media presence, anywhere that any information that you're sending out, that same message resonates, and that will be dictated by those things that you choose. It's important to create an online presence, and this day and age, it's free advertising to jump on any of these social networks, whether it's Instagram, Facebook, TikTok, LinkedIn, YouTube, the Threads. There's so many out there that you can get on, and you can jump on them according to what you enjoy doing. Next, we talk about patient communication. Your communication with your patient starts from the minute that they contact your clinic, and so that's a longer conversation talking about how reception answers the phone and how the door's opened. But let's go from the first moment that patient walks into your room. You really want to create a personalized experience for them. You want them to know that you care. When they walk in the room, you're looking at them, you're looking them in the eye, you may shake their hand, you have them sit down, and you give them your full attention. You don't want your back to them busy doing something else when they walk in, making them feel like they're not important. It's important that the communication is not rushed. The patient is given time to talk to you in detail. And also, it's important that you're listening to everything they have to say, that they feel like they can talk to you about whatever it is that's on their mind without feeling like that you're rushing to get them in and out of the door. I've got a new patient consultation module available on my online courses where I go into a lot of details about that new patient consultation and how important communication is. It's really important not to use dental jargon. You want to use words that they understand. You don't want to say, we're going to get whitening gel and your trays to the lab and get, for your bleaching, because patients don't know what trays are. Lab sounds like some scientific place. Bleaching sounds like something that you clean surfaces with. So, be really careful with the wording that you're using. And then we talked about imposter syndrome. And again, that's a massive topic that we could talk about all day. But just to kind of put a little snippet in about that, I think the first thing to understand is that it's normal. I think it would be worse if you were someone that never suffered from imposter syndrome. It's important to not focus too much on perfection. As dentists, we're so focused on just being perfect at all times and maybe focus more on growth rather than perfection, and allow ourselves the space to do that, to know that we're doing our best and to continue growing. And then also to use reframing tactics so that when we know that we may be suffering with imposter syndrome, and if we can acknowledge that perhaps it's not how we should be feeling, it's just how we're feeling that day, that we can stand a bit taller, chest out, back straight, smile on your face, and let it go and make sure you exude confidence, because if you show that's how you feel, then actually that is how you'll end up feeling. So I hope those tips helped you. It was a pleasure to provide them on International Women's Day for those that attended, and I hope that they help you today also.